Morning everyone. So today we're gonna start showing how to do body filler. You know, it's a new trend. People are asking to get more volume on the hip tips, to fix the hip tips, to get volume of the buttocks. In this case, we have a patient. She's a gym patient, means she goes to the gym 3 times a week. She's very fit. She's very good actually. She doesn't need much volume on the buttocks area, but as you can see, she has quite deep hip. So the first step we have to do is, of course, checking all the patient, doing the first evaluation of the patient. As we can see, she has a bit of scoliosis, and you can see that the right side is quite deeper than the left side. So this is the most important things, because when the shoulder are one lower, one higher, automatically the hip, they go one higher, one lower, and vice versa. So the evaluation of the patient is the most important thing to plan how many syringes we need. To give the result to the patient she wants, and of course to plan the result that the patient can have, because not all the patients are good candidates for body filler. In this case, we're going to mark the area where she has the depression, the hollow part, and it's usually always this part taking a shape of a beam with the hollow area here. Yeah. So we start with the right side, which is the deepest one, and we have to inject all this area. Now, it's very important to do the drawings while the patient is standing up and without shoes. Why that? Because whenever she lays down, the anatomy is changing completely. This part goes higher, and so our injection is not precise. Almost very important, if we have the main depression, the main groove in the middle of the area that I mark, I don't have to inject close to the edges, because if I inject close to the edges, I just give more volume here, showing the depression more here. Another very important thing is that when the patient comes to you, they always ask for more volume on the buttocks. If the patient has the deep hip, first of all, we have to fix this one, then we can work on the volume. Why? Because when we fix the hip tips, automatically we get this, which gives more projection to the buttocks area. And the main concern of the patient is that when they wear a tight dress, here there is the depression, not here, because here she has volume, but here there is the groove. So we have to fill this part in order to give the volume, in order to give more projection of the hips. As we can see, talking about the anatomy, we know we have 3 main muscles, which are the gluteus maximum, the gluteus medius, and the gluteus minimum inside. The marking for the buttocks area are exactly this. Okay, and this is the lower part. We never inject on the lower third of the buttocks. Why? Because, okay, this is not the case, but if the patient has loose skin and we add volume and we add weight here, this part will go down. We cannot lift from here. We have more chance to give a bit of lifting when we inject on the upper part. Another important thing to keep in consideration is the evaluation of the patient of the love handles. Some of the patients, they don't need to fill the gap here. They need maybe to remove a bit of fat from the culotte de cheval or from the love handle. So it's very important, the first evaluation of the patient. It's very important to be fair, and most of the time it's much better to do a combined procedure. Try to convince the patient going through a small liposuction of the love handles and the culotte de cheval, and then in case, or doing a lipofilling, or put the filler after 1 week, 2 weeks from the surgery. We're gonna have our entry point actually in a nice area where is a bit of fat, so it's gonna be easy to inject. This is fair enough, because with the cannula I can reach all the points I want to inject. Okay, and that's it. So now we start with the left side on our patient, and if you remember before, the right side was deeper than the left one. In this case, we don't draw the pin like we did on the other side, but we draw just the depression area where she needs more filler, which actually is this one. And then if you see, there is a bit of lack of volume here. So in this case, we're gonna fade. We use always this one as access point, and we're gonna fade the filler all over this area in order to give a bit of volume and a bit of projection like this, and will be symmetrical to the other side. So now we start the injection on the left side of the patient. The main difference is that, of course, because of her back, this part is a bit more fuller, it looks more fuller. So in this case, we use this one as entry point, and we're gonna fade and inject the filler in this area in order to give more volume all over the hip and the anterior part of the buttocks, and give this kind of projection and make it similar, almost the same on to the right side. Here we are ready for the injection. Now the first important thing, guys, and I'm kidding you not, is do the proper disinfection of the area. We have to clean it like we are going for a procedure, for a surgical procedure. Because the only way to have infection after the procedure is because we cause it. So we clean the whole area, tapping, and then we clean the dry gauze. And then tap, tap. And we start with local anesthesia only on the entry point. Why only on the entry point? You know, there are many scientific works in which they see that if you do the tumescent solution in the area where you have to inject filler or fat in case of lipofilling, when the effect of the adrenaline will be ending, will be more inflammation, more blood going down to the area, more inflammation, more absorption of the filler. It's the same for the fat. So actually, if we are in the right plane, which is the superficial fat tissue, the patient won't feel anything. Mostly she has almost perfect skin, so she doesn't feel anything, she will not feel anything. So injection of local anesthesia of plain lidocaine only on the entry point. Then we will go with an 18 gauge to make the entry point, and with the cannula we inject the filler all over the area. Okay, now you will feel a small injection. Always inform the patient about the injection. 1, 2, 3, that's it. This is plain lidocaine. Always do the suction test and give a check to the skin if there are superficial vein. Small injection, and then we go a bit more superficial. She will feel a bit of burning, which is normal. There you go. We injected 0.4 ml of plain lidocaine, and now we go with the needle 18 gauge to make the entry point. 18 gauge needle. This is very important part. We go perpendicular to the skin, okay? We just put the tip of the needle of the area we did the injection, and we press slowly without rotating or without tilting the needle. 1, 2, 3. There you are. You will feel a click under your fingers, under your hand. Means you went through the dermis and you are on the superficial fat layer. The superficial fat layer is our layer of injection. There is no retraction of the skin, so everything is free. There is no blood coming out. We just remove this one. We have a cannula of 10 centimeter, 19 gauge. Each tag on the cannula means there is 1 centimeter. I always mark, because most of the cannula they have an arrow here indicating the exit point of the filler. This one doesn't have it, so I just mark here at the beginning of the cannula where is the exit point. We go perpendicular to the skin on the entry point. We feel it bouncing, means we are on the superficial fat tissue, so we are touching the superficial fascia. If it would be deeper, so touching the deep fascia means the muscle, she would feel pain. Do you feel anything? No. So like this, we tilt the cannula. We lift the skin, creating a pad, and with a continuous pressure, we just go inside. No stopping the patient, and just going through the skin. It's possible sometimes the patient feel a bit of resistance, a bit of pain because of fibrotic tissue, but still. Are you okay? Mm-hmm. We're in. Here is the tip of the cannula. We are on the right plane, is moving and tilting right and left, and we start the injection now. Always the exit point towards the dermis. I will start with a retrograde injection here in order to create a bit of anesthesia, because each syringe is diluted with 1 ml of lidocaine. Now the patient is not feeling anything. If the patient feels pain, there are three reasons. Or we are deep, we are touching the muscle, or we are superficial, we are touching the dermis, or the patient had previous treatment or she has fibrotic cellulitis, so we have fibrotic septum and which are very sensitive to the patient when we go through with the cannula. So now we inject on this area. I am exactly here with the tip, so I'm injecting exactly on the line I draw. We inject the bolus, creating a bit of space and injecting a bolus like that. Feeling the filler here. Fine. So after we clean and disinfect the area again, we ask the patient to stand up in order to check how much volume we gave and if it's in the right place. Now this patient, she doesn't need too many syringes, but sometimes when we have patients which are a bit bigger, with more the indentation, with more depression of the hip tip, we can even do the injection while she is laying down. Usually I use a surgical cannula for lipofilling of 1 mm, which is longer than 10 cm, in order to move from one entry point in all over the area, and we can give volume according to the skin elasticity of the patient. So now that the patient is standing up, we can see that here we gave a nice volume, but if she turns a bit and you see the side, you can see that in this area there is still a depression. It's normal because we have to inject gradually in order to fill completely the gap. So now our target is this part. I will do the injection while the patient is standing up, and looking from the front there is a small depression here on the trochanteric region. So always with the same access point, I will go all over this area to give a bit of volume. Now when the patient is standing up, the game changes a bit, because of course it's not easy like when she's laying down do the injection, but still with a good practice you will be able to. The right place, always on the superficial fat tissue. So we are here with our cannula and I start the injection. Now we go here. You feel pain?
No.
All good?
Mm-hmm.
I'm feeling the filler under my finger. This is the way I can give the volume. Okay, now we finished our third syringe. Clean the area and we check. Always we put a finger here to avoid the filler to go out, and we massage a bit the area. This can be a bit awkward for the patient, just inform the patient you are doing that. On the lower part of the buttocks, we have what we call retaining ligament. There are no real ligament, but there are kind of a virtual ligament which pull the skin always down. Can you contract the muscle, please? As you can see, whenever the patient contracts the muscle, this part is going down. Now, relax. In my experience, I don't suggest, and I can tell you it's not always possible, to give the full roundness and the fullness on this area in the first session, because we need a bit of time for the skin to accommodate the filler in order to be a bit more elastic. She doesn't need much. We'll try now to do a small injection just below the entry point in order to give a bit of volume, but she might need a touch up after 3 weeks in order to fill again this part. So we mark the small depression that it's exactly here. I will go from the entry point, small bolus here, and that's it. This is already nice volume, a nice projected buttocks. She doesn't need more. she has to be proportional with her body. She is skinny, she is tiny, so having a huge buttocks won't give, in my opinion, won't give her a good result. Now here is full, here the projection is nice and smooth. We just add a bit here in order to fill the small gap that she has here. As you can see, it's quite difficult to go here because of this virtual ligament, which basically are fibrotic septum. Are you okay? Mm-hmm. And we do the injection, lifting a bit the skin, and we see live how it's filling up. Show me. Goes, please. Small massage. Always when you do massage, keep the gauze on the entry point to avoid the filler to come out. I believe it's perfect. My opinion and my suggestion, do not overcorrect. The filler, just because it calls water, grow by 10% in the next 2-3 weeks. So the overcorrection can give you some small asymmetry, which then it is going to be difficult to correct. It's better to add a bit more after 2 weeks, after 3 weeks, after 10 days, according to the patient result, instead of going to remove the filler. This is already a good result. We will compare the picture before and after later. You will see I use only 3.2, 3 syringes and 2 ml. So totally 32 ml to fill the gap of the deep hip. You don't need 20 syringes. 3.2. You want to add volume, you need more volume, you need more syringe, of course. But to fill this one, injecting in the right place, 3 syringes will be enough. After we finish the procedure, after we did the injection, we apply some elastic tape. In this case, we are using the Isofix. This is, I believe, 2 inches wide. We can use a bigger one, a wider one. And we will apply, stretching a bit, just below the area where we inject the filler. Okay. And above. Now, we don't need a compression because the filler is quite elastic. But we need something to reduce the spreading of the swelling. I know it looks weird, but trust me, it works. Here and here. The patient has to keep this tape for 2-3 days. As long as she can. Okay, fine. You can see from both sides. This is the final result. It's symmetrical compression here and here, area of injection, and nice result. Show the side, please. Nice projection, fuller appearance of the button.